Hi everyone, welcome back. Today we're joined by RJ Bunnell, Hospitalist and Medical Director for Care Transformation here at Intermountain, to talk a little bit about his recent experience in New York City. He was one of the 100 caregivers that was deployed to New York to help them in their fight for COVID-19. RJ was specifically at Northwell Health in Long Island, so today we're going to be talking a little bit about the lessons he learned, his perspective of what happened there, and just catching up with him generally. RJ, thank you so much for joining us.
Thanks for having me.
So RJ, can you tell us a little bit about, in general, what you do for Intermountain? What does a hospitalist mean, just so we can kind of set the stage?
Yeah, sure. I get that question a lot. I think my dad still thinks I work in the emergency room. We admit patients to the hospital and take care of internal medicine patients that need to be hospitalized. And then in my care transformations job, essentially we try to make it easier for people to do the right thing by setting up order sets and workflows in the computer system to just optimize care.
And how long have you been with Intermountain?
13 years.
Okay, so you've been here for a while.
Yeah.
Have you always been interested in the field that you were in? Did you start out doing something else within Intermountain?
I started off as a hospitalist, and I've loved that. I led our group for 7 years, and then I transitioned over to the care transformations job, because I was just interested in how technology and the way a workflow is set up influences clinician behavior. Just found it really fascinating trying to figure out how to make it easier to provide the best level of care and influence bedside care through the tools we use.
So when you heard about this New York experience and that the fact that Intermountain was sending caregivers there, what made you want to actually go to New York? What was your deciding factor on going?
Yeah, a lot of people have asked me why I would want to do something like that. Maybe I have poor judgment. So I admitted the first patient in Utah to the hospital with COVID at beginning of March. And end of February, beginning of March, it was all about preparation here in Utah, trying to get our teams ready and prepare for this, what looked like it was going to be just a wave crashing over us. When we didn't get as many patients as we anticipated, I was watching a webcast that we did with Sarah Beasley, and I was just really impressed. She's an intensivist who went on her own to New York Presbyterian, and I just thought that was an amazing thing to do and started thinking about how I could get out there. And when I saw the email asking for recruits, I talked over with my wife, and she was super supportive. She does that kind of disaster response work herself.
Okay.
So she would have gone if she hadn't just had neck surgery. And my heart was pounding, and I pressed send, and I started lobbying everybody I knew to try to get a spot on the team. And got a call from Paul Krakovitz, and he told me I was going to be our physician lead, and I was super excited. So I just wanted to be part of it, and I felt like my skill set as a hospital doctor could be helpful, and it just seemed like a great opportunity to be a part of a very unique period in time.
When you initially told your wife that you were going to make the decision or started talking about that, was there any sort of fear that you guys had? I know COVID wasn't as big here as it is in New York, but
Yeah.
Did you guys have a conversation at all about what could potentially happen there?
Yeah, absolutely. I'll be honest that I wasn't afraid of this virus until it was time to send the email to ask if I could go on this trip, because that's when it became very real for me. She was supportive. She knew I would be careful. And all in all, I guess I'm a very kind of left-brained guy, and I just knew the statistics and the odds and knew that I would have the protective equipment that I needed. And sometimes I feel like it's important in life to be concerned, to be a little scared, and do things anyway. It's a good growth opportunity. So I viewed it as that and a chance to help out.
That's really great that it was almost like a take a leap and kind of see what happens type of thing. And I know that you guys found out only like 2 days before you left that you were going to New York. What was the preparation like in order to go to New York? Did you guys have to do any sort of trainings before you left or gather any PPE that you were taking with you? Kind of walk us through that.
Yeah, so we were really well taken care of by Intermountain. So Heather Brace and her team were just fantastic in terms of making sure we had PPE, just letting us know what to expect. Most of my preparation, honestly, was packing, taking care of my garden, wrapping up loose ends before I left, because I knew we'd be gone for 16 or 17 days, and it was going to be a long time to be away from my wife and my loved ones. So, yeah, we really, Intermountain took care of most of the details for us, and we were lucky. I think we had actually 4 or 5 days to be at home before we actually left, which was nice, because I'd heard rumors we were leaving Saturday, and that was going to be a quick turnaround, because that was Friday when I heard that.
That would have been very quick.
Yeah.
Okay, so you get everything from Intermountain that you need. You get to the airport. I know that there was a pretty decent send-off for you guys, which is really cool.
Yeah.
We actually sent someone from our marketing team with you guys to
Yeah.
help out. When you got to New York, we talked before that you've only been there once before, and it was right after 9/11, which was another time when the city was very different. When you guys landed and you got to see New York, what was your initial reactions to what was going on and what's normally this busy city? What was happening in your mind?
Yeah, I mean, the whole trip there was really remarkable. The Delta staff were giving us applause when we left. There were announcements on the plane. It was a little bit embarrassing, honestly. And we got to JFK, and it was totally deserted. All the shops were shuttered. I saw a team of people that looked like maybe they were maintenance or sanitation workers, just wearing full Tyvek suits and PPE and respirators and whatnot. And it became clear as we walked past them, they were actually just a bunch of tourists that had probably come from Asia to visit New York during the time of pandemic. That was kind of funny. But really, everyone was wearing a mask, the few people that were there. And you could just tell that it was a city that was just eerily quiet. We took a trip in to visit a couple facilities, and Fifth Avenue had one car on it for miles. There was no one in Central Park. No businesses were open. You could stand in the middle of Times Square by yourself. Just never seen anything like it, except maybe the first time I went to New York. So I look forward to going to New York during some normal times and going to some businesses and being able to go inside and that kind of thing.
You'll still want to avoid Times Square, though.
Right,
I lived there for a while, and when it's busy, it's very, very busy. So that's a very unique experience to take in New York when it's this empty place, because we think of it as such a crazy atmosphere.
Yeah.
Were you guys given your assignments of the hospitals that you were going to before you left, or did you guys kind of find out once you got there?
We just found out once we arrived.
Okay.
Yeah.
And you were in Long Island at the Long Island Jewish Medical Center for Northwell Health. Can you tell us a little bit about your experience working there and any stories that kind of resonate from your time with them?
Yeah, sure. So it was more suburban than I had anticipated, so that was a little different, because we had been, I guess, just being from California and living in Utah, I thought New York, skyscrapers. I thought we'd be in this inner city environment. So it was very suburban. We pulled in, and they had a bunch of balloons up celebrating their 1,000th discharge of COVID patients. They had been really overwhelmed the 2 weeks prior to us getting there. We caught the tail end of the plateau where they were just still bursting at the seams with patients, but about to start discharging more patients than they were bringing in. I was struck by several things. Going into the hospital, there were tons of homemade signs and encouraging placards just from the community. There were the ubiquitous refrigerated trucks behind LIJ. I think there were 3 or 4 of them when we were there, and that was really kind of shocking and sobering. The team itself that I worked on, just an amazing group of really compassionate providers, one of the most diverse groups that I've ever worked with. And I was just struck by, despite a couple of them having had COVID themselves, they were at work every day. They've been doing this for 6 weeks. Constantly in the hospitals, you would have these calls for rapid responses and code blues, where normally you have a couple of those a day when a patient deteriorates quickly. There were 26 our first day there. Oh. And another thing that was really striking to me was how, because there were no visitors, every doctor called every family every day. And some of the conversations I overheard, they were heartbreaking, but they were also just great examples of just this compassionate care that these providers were still giving 6 weeks into this. So yeah, I was really impressed by the hospitalist service there. They had been totally overrun. They went from 200 to 600 patients.
Did you know any of the Intermountain team members that went with you before you guys got brought into this like close-knit circle?
Yeah, I knew Whitney Hilton works in my group at McKay, and Eva Harris works in our group as well as Carl Houghton. So those 3 had expressed interest in going, and I was glad they got spots on the team too. I didn't really know anybody else, so that was a fun challenge, trying to learn my team members' names with masks on the whole time.
Remembering what they looked like.
So I was I got to know people's eyes very well, and finally by the end of it, had learned 46 people's names.
So at Northwell itself, did you have a designated unit that you were specifically working on? You said that you were the physician lead. Did you kind of bounce around from different units, or were you located in one area?
Yeah, I bounced around a lot. A lot of it was unintentional, because that place is a maze. And it took me about a week to figure out how to get to the hospice office, down to the cafeteria, find my scrubs, and get back to my office. So I explored a lot of LIJ, but mostly I was going from our hospice office down to the emergency room to admit patients, sometimes to the patient floors. And then I did get a chance, Dixie Harris was great and showed me around Southside Hospital on a day I had off. I was able to tour a couple other facilities with some team members. But my clinical work was mostly in the emergency room, evaluating new patients, writing initial orders, and getting them upstairs.
Just so people know, too, and kind of understand the size of that hospital, what would you say it compared to an Intermountain facility? Is it a lot larger? Does it have the same number of hospital beds as we do?
Yeah, I think it would be something akin to IMC.
Okay.
And then imagine doubling the number of patients in there. So take all the single rooms and put 2 patients in there.
Yeah, we saw a lot of that happening from the footage you guys took and the stories you guys shared with us back, that there wasn't a lot of empty places there.
No, it was really packed. I've never seen anything quite like it.
So as you look back at your experience in New York, what is the biggest lesson you feel like you learned while you were there that you can bring back to your everyday role here at Intermountain?
Yeah. I had one particular experience just with one of the nights I was rounding in the ICU. I was just checking in on some of our caregivers there, and I saw this older Hispanic woman who had her eyes open while she was on a ventilator, which is not totally the norm. Most people are unconscious, sedated. And she just kept motioning over to us, and the respiratory therapist we were talking to said, "Oh, that's Maria. She just wants to hold somebody's hand." And I saw her drop what she was doing, which was talking to us, not as important, and went over and grabbed this woman's hand. And I, feeling kind of useless, went over the other side and grabbed her hand. And we just sat there for 5 minutes. And what struck me in that moment was how, this is an ICU where there's screens and beeping and monitors and high tech and medications everywhere. Sometimes the most important thing to a patient is some human touch, especially if you've been lying in a bed for weeks on end, you don't have your family there. And it really struck me that it's important that as much as we can, if we can free up our caregivers' time from tasks or charting or anything they're doing that's not contributing to the patient getting better, to free up that time for those human connections, that was definitely a lesson that I brought home with me, and hope to do that with my more computer informatics type work with care transformations.
I think that's a really important thing to note too, especially when, like you mentioned, they don't have visitors right now, especially if you're COVID positive. I think it was really interesting to hear that the doctors called the families every day and talked to them, whether it was good news or bad news. It's just that connection. And I think if you're listening to this right now and you feel like you can't go to the hospital because of that, just remember that there are doctors and nurses
come see us.
Who are taking care of the patients who are there and making sure that they do get that human interaction every day.
Yeah.
So, RJ, is there anything else that you wanted to mention about your time in New York or anything that you learned while you were there?
Yeah, again, the no visitation thing was tough, and I do hope that we can keep calling our patients' families whenever we get the chance. It is very much appreciated, and I'm hoping maybe at Intermountain we'll see how we can balance visitation with safety, if at all possible. So I think our patients may do better. And I do hope the general public just knows that this virus is real, that none of us have any interest in promoting. I mean, it's not like having a pandemic makes doctors' lives easier or makes us rich in any way. This is just a real thing, and it's nobody's fault per se. I just hope that, going forward, we'll realize that this is not the flu. It's already killed, 5 times more people in Long Island than the flu did in the previous 5 years, and that's in 2 months. That it's going to be around for a while, and that I'm hopeful that we can do simple things like wear masks that just prevent, aerosolized droplets going to other people. You may transmit the disease with or without symptoms. And I'm hoping that people will look for ways to help and avoid the finger pointing, and just understand that it's not that we need to be open or closed. It's just that we need to prevent infected people from being in close proximity to non-infected people, especially indoors. And however we can do that, let's do that. So to boil this down to open or closed or pro-business or not, or pro-death or pro-life, it's just, those are simplistic arguments. This is a complicated, evolving situation, and let's figure it out together. And I guess that would be my parting thoughts.
Well, RJ, thank you so much for joining us. We really appreciate your time. And if you guys have any questions about COVID-19 symptoms and would like to get screened and tested, you can call the COVID-19 hotline at 844-442-5224. We also have our emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. And that phone number is 833-442-2211. Thanks, everyone. We'll see you next time.